Hi everyone, thank you for joining. Unfortunately, I am going to have to cancel class this Monday, October 30th. Something just kind of urgent popped up out of nowhere, so I apologize in advance. I know we haven't met a lot, just, due to holidays or me traveling to University of Tennessee and things like that. But I do apologize for that. This wasn't something that was planned. So one thing I will do is I will offer office hours this week. Wednesday from 2 p.m. to 3 p.m. Eastern Standard Time, as well as Thursday night from 5:30 p.m. to 6:30 p.m. Eastern Standard Time. So if you want to hop in and go over the policy process, making the plan assignment, I will be there for that. But hopefully this video will help you understand it better. And after you watch this, please feel free to schedule your own Zoom session with me if those dates I provided don't work with your schedule, or perhaps you're working on it and you just haven't, something pop up and you want to send me an email, I gladly will respond to that. So do what works best for you. But this is basically what I would have done in class on Monday, minus the live feeling for it. So hopefully you find this helpful. And again, I will have office hours Wednesday, 2 p.m. to 3 p.m. and Thursday, 5:30 to 6:30, just open office hours if that works for you all. So one thing I just wanted to bring to your attention is the next 2 weeks, we will be covering health insurance. And health insurance is a very big topic, as you all are aware. So we're going to have 2 modules devoted to it. And I will have them both open by Monday. So you might watch this video before Monday and be like, I can't see it. I promise I'll have it open before Monday at the latest. I'm going to try to get everything done today, Saturday. So as you can see here, let me actually pull up the syllabus. So the only thing that you have due November 5th will be the discussion board to the health insurance discussion, as well as this policy process paper that I pushed the deadline back a week for. All right, so this is probably the one thing that most of you have a question about. So let's start there. So this is that big assignment that we've been working on all year, right? About the governor's putting together a task force to improve the health in the state. The purpose of the governor's health initiative and visioning collaborative is to engage leaders around the state to guide the initiative, aligning with the overarching premise of improving the health of Tennesseans or another state. So your just focus is going to be on one specific state. It's not a US project. It's not a county level project. It's Tennessee, but I'm aware some of you don't live in Tennessee and might not want to do Tennessee. So if you live in South Carolina or Colorado or something like that, feel free to do that. And you and your team will create an initiative that aims to address a pressing public health issue from a system level. Ideas for your overarching initiative might involve infrastructure improvements, including new integrated programs, changing healthcare policy, or shifting existing regulations in an effort to fuel progress towards a healthier state. So what you're going to do is you are recommending a program reform or other attribute to the health initiative. So an example could be like expanding Medicaid in the state. So each student will provide a description of the policymaking process for their proposed system, policy, or environmental change for the health initiative by applying a known CDC framework. So I just want to point out, because this might be confusing, so I will fix this. It'll be fixed before you actually watch the video, but I wrote you and your team will create the initiative. This is an individual assignment. Your whole project is a group assignment, but this part is just individual. So everyone will do this policy plan assignment on their own. So you might, be wondering like, well, what's an example of a known framework I could do? So this is just the one that a lot of students use in the past. It's pretty simple. And this is the CDC policy process. And what you would do was you would just start off with these steps right here. So what is the problem identification? So what's the root cause of a public health problem? And just write a problem statement. So this is the problem. Policy analysis. Identify possible policy options and pick the one you think is best. So here you're considering several destinations and you decide between them. So what would be a great policy option that would address this problem right here? Strategy and policy development. So plan how to develop, draft, and enact your policy. In this step, you're choosing the route of your destination. So you decide what the problem is. You're going to identify the best policy options. So then how are you going to get there? What are you going to do to make this happen? Then you're going to follow official procedures to get your policy authorized. This is when you actually depart on your journey. And then the policy implementation. You plan for successful policy implementation and achieve the best desired outcomes. And this is successfully traveling to your destination there. So that's just an example of something that you can use. There's this nice little graphic here too that you can use if you wanted to for that. All right, so let's go back to this. So, and I know this is a lot of stuff and it can get kind of confusing there. So before you start, just brainstorm some of the following stuff. So consider for inclusion. So who would be involved? So if you want to, get something, off the ground running, who would be involved in this? Is it community members? Is it someone in the, who works at the government, someone in policy? Who would it be? And I want you to write about what the process looks like. What does it take to get an idea to policy? So like consider tobacco 21, like that was an idea. Let's raise the age of smoking from 18 to 21. So that was an idea. And then we actually got there and it's policy now. So what were the steps that would happen? What ethical considerations are involved in determining your part of the policy? So just consider at least 3 ethical considerations. So and I'll show you an example of what this would look like. What's the evidence for your proposal? So for tobacco 21, right? What was the evidence for it? Well, they showed that I think like 91% of people started smoking before the age of 18. So if we pushed it to 21, could we eliminate a lot of that? They just talked about, the risk factors of smoking and how a lot of high school students who are 18 are getting it to their younger classmates. And there was just the evidence that they brought to that, to why that would support their policy proposal to move forward. What could be some intended or unintended consequences of the policy? So this might cause you to take a step back. So like what would be something that would be good, or what could be some unintended consequence we don't know? Remember, the process is not complete without describing the legislative process. So I want you to refer to your textbook with chapters 2 and 14 and the CDC policy process that I just showed you right up here, to just go through those steps, because you might be confused and like, oh shoot, like this is a great idea. How do I actually get this forward? And that'll walk you through it there. So this is a graded assignment. As I mentioned, this is an individual assignment. You may review policy briefs or other policy proposals for guidance for that. Let me know if you have read through all this stuff and you still have questions. So this is what I'm looking for. I like you to have title headers on your paper. It's easier for you. So I always just start out when I write a paper as a student. I get my paper, I have my title page, and then I'll just start a sentence, problem or focus area, whatever you don't want for the header. And then write the next one, purpose of the proposed policy, ethical considerations, evidence and rationale, right? So you have all the layers, and then you can just plug in paragraphs for each one, so you're not missing something. It's easier for me to grade it and things like that. So, what's the problem, the purpose, I read all that stuff. I kind of went over all those. So this is just what I'm looking for. What's the process and how important is the evidence to the stakeholders? So is this really good, important evidence that you're going to get them excited about it and wanting to make a difference? So, and then list examples of how evidence can be used to move your policy forward. Maybe you're like, this has been done in another state and look how effective it's been. Things like that you're going to use. So this is an example of this is an exceptional paper from a student, and I don't want you to panic like, oh my gosh, this is so long and detailed. Like, she's just definitely an amazing student, did a very good job on it. Yours doesn't have to be this long. This was very detailed and I wanted it to guide you in the right direction. So I started off with the area of focus. So nearly 70% of the state's 95 counties within Tennessee have at least half of their residents living within the designated rural area. Roughly 93% of the state is classified as rural. She explained with that much there. So research has shown time and time again that the impact of geographical location has on healthcare and health-related outcomes, even when compared to genetic factors. Talked about all this stuff that's going on in rural communities. I won't read this all for you, but she just gave a very detailed background about what is going on. And then you can see right here, since 2010, 138 hospitals across the state have closed for reasons including lack of medical workers, lack of funding, and increased organizational costs. Let me make this a little bit bigger for you all so you can see it as I'm reading it. These closures amplified the need for medical care access in rural areas, as more rural Tennesseans face increased limited access to healthcare, including mental health services and providers. Within the state, 100% of the counties are experiencing a lack of mental health service providers, and 90% of all counties in Tennessee are experiencing a shortage of primary care providers. Increasing access to healthcare in rural Tennessee benefits the entire statewide community, as well as residents as part of an interconnected community. So this student right here, you can see their focus right here, if you just were to read this through, is to increase access to healthcare in rural Tennessee. Okay, so policy purpose. The policy aims to formally establish a grow your own healthcare worker initiative to develop a pipeline providing a streamlined opportunity to recruit and retain counselors to increase access to healthcare, specifically mental health care in rural Tennessee. So see that header right there, policy purpose. I'm guessing no one's gonna have, I don't even know if you need to have the area focus. Let me zoom out of that real quick. So what's the problem? Yep, so that was just, the background, what's the problem? So that student did a good job explaining what the problem is. You don't need to have it that long. If you just have 2 paragraphs or something like that, that's completely fine. Or maybe you're really interested in the topic, you have a lot there. Policy purpose, just a quick paragraph there. So then this is the policy process. Let me go back. I know I'm all over the place right here. So let's see where we went. I don't know if the student followed everything exactly in order, but you can do it in your order too, whatever works with the flow of your paper. So let's make this bigger again. Okay, so remember that framework I had, right? Policy identification, that's exactly what they did right here. They talked about what they needed to do for their, go back here, policy analysis. Talked about the policy analysis and what that would include. Strategy and policy development, policy enactment, and then policy implementation. So this student chose to do that CDC framework. They did a wonderful job on that. I won't read it all word for you, because I know I don't like when people read for me, and this example is on Canvas for you to read as well. So then they talked about the ethical considerations. Since this policy includes formal establishment of an initiative to help generate a local mental health care workforce, a critical aspect is to ensure these local workers are provided necessary training, support, and resources to achieve the tenets of the Grow Your Own initiative. Keeping the promises and core components of the initiative that are shared in the recruitment process, providing the necessary support from the partnership with the University of Tennessee, and ensuring partnerships are solid and involved are a few components that will help ensure recruited individuals from the local community are not exploited and receive the benefits of the Grow Your Own initiative. Let me jump down a little bit there. That's just more information. An ethical consideration to remain cognizant of during the policy development process is remaining understanding and considerate of the culture in Eastern Tennessee. East Tennessee is part of the Appalachian region. While this region encompasses a host of cultural considerations, values, and unique strengths and aspects, there's also diversity. East Tennessee is part of the Appalachian Mountain region compared to West Tennessee, which is part of the Delta region. So they just gave some background right here. And it will be vital to the success of the policy to remain aware, respectful, and cognizant of the culture there. Okay, and then I just missed there. East Tennesseans generally have characteristics of being independent, reluctant to accept outside help, and are very proud of their communities. Okay, so evidence, importance to constituents. So let me go back right here again. So I think we needed, what is the evidence or rationale of their proposal? Oops, I think I'll have to scroll back again. I apologize for that. But you can just see the students kind of followed all the questions I had by putting the headers there. There was that CDC framework. Oops, I think I may have missed it there. Okay, so there was just evidence about, the program they're implementing there. As you can see that. Okay, and then the consequences, they broke it up in intended and unintended consequences, depending on what you have. You can combine them all in one paragraph, explain quickly what intended is and unintended, or you can do it separately too, that's just as easier for you to process there. So an intended consequence of this policy is to increase the number of counselors in rural East Tennessee. That's the intended consequence. We want that to happen, right? We want there to be more counselors. Okay, a potential unintended consequence of this policy is that local communities may not initially perceive the benefit, decreasing their interest and willingness to proceed in the future. Developing a workforce can take time, so the results of increased practitioners may not be immediate, right? It's not like this is going to happen overnight. The process may become frustrating for some and cause questions regarding the benefit of the policy for them. And then they just left a conclusion paragraph about what this is, the strengths, and the suggested policy there. So references here. Reference page isn't perfect, as you can see, but they did their best there for that. And so even though it is 12 pages, 2 are references, 1 isn't a full page. So I would probably say the students was about 8 pages. So no page limit requirement. If you can answer everything in 3 pages, fantastic. I've had students who were very condensed and answered it all in 3 pages, and they hit all the sections and did a very good job. And I believe I had one student whose paper went all the way to 16 pages, right? And so this one was kind of a middle ground I found for you all. So I hope this helps you there. The most important thing would just be picking a topic that you want to move forward with. And you can use what you've been doing for your overall project for this class. You can pick something else that you're passionate about. What I actually will do, I will go through, I'm gonna write this down so I don't forget, go through old papers, and I can share more topics. 1 second. I have to be very detailed with my notes when I write them down, because I write something like do this, and then 2 hours later I'm like, I don't know what this is. Okay, so 75 points. Please don't stress about this right here. So again, this is just a rubric I have. You identify the issue. Description of the policy process. So just make sure you are describing that CDC framework or whatever one you choose. That's 20 points right there. Ethical considerations, role of evidence. So that's just examples of evidence of why this would be helpful or why your community needs it. And then just your APA references there. Okay, so let's go back to the module. And this isn't live yet, so I might have to go through and make some changes, but I did just want to get this video out for you in case you wanted to watch it over the weekend and maybe take your Monday night off, or feel free to just watch this Monday night during class. Okay, so what I will have for you for module 11 and 12, we're just discussing health insurance and policy. So I'll have the assignments linked there and the dates to remember like you usually always do. You're going to read chapter 8, understanding health insurance, and I have a PowerPoint slide for you about health insurance as well. I'm going to have a discussion board for you about health insurance coverage. So what you're going to do is actually look at the state of Tennessee benefit comparison, and this loads for me. I'll have you look at this. Okay, so this is just the health plan comparison of member costs. So it talks about Premier PPO standard, and it shows like what in-network and out-of-network costs are. Just take a look at this. Some of it might be really confusing. Some of it might make a lot of sense to you. I know personally when I was applying to University of Tennessee and got accepted, I live out of state, I live in Arizona, right? And I needed to get health insurance for my family, and I was very confused about, all this stuff. And I didn't know if I was supposed to get the standard PPO or premier PPO. And there was like all these other terms, and I was just like so overwhelmed. So I actually had to call the director and be like, I live in Arizona. I have a husband and a son. Like, what would be the best for me to get? Here's our situation, our ages, and things like that. So I just want you to look through this and just try to, understand what you understand. If you have questions about something, then leave it for the discussion board too, or try to look stuff up. So I want you to look through that. Okay, let me start from the beginning. And I want you to try to get a copy of your own coverage as well and see if you're able to compare it. So I want you to review the example provided or your own health insurance coverage. So if you don't have access to yours, just review this one. If you do have access to yours, you can just review that one. And this is a great opportunity for you to understand your health insurance coverage better, or you can look through both and see if there's anything you can compare. So think about the following questions. What does the policy cover? What terminology is being used? Just have more questions for you to answer as well. You can, say anything else that was surprising to you or not. How do you make this choice of health insurance policy if you are offered 5 choices? So how do you make the choice of what policy to get? Do you pay more each month so you have more coverage, or do you pay less and take a chance hoping that nothing will happen, right? Thinking like, well, we're young, we're healthy, like I think we should be okay. We don't have to pay as much in there. So then part 2, I want you to reflect on the following additional questions. What is unique about this health insurance policy? Is there anything that stands out to you? Maybe you're like, no, this has been my health insurance policy for a while. I don't think anything was too unique. Or just find one thing that stands out to you. What are the benefits of this health insurance policy, yours or the example one? Is there like, oh my gosh, I have 100% coverage, or, my copay is really low, or, something like that, or maybe something unique is like, I didn't realize how terrible my health insurance policy was. Why would you consider this health insurance policy as beneficial or not beneficial? Or is it good or bad? We can have a discussion about this during our live session, but my dad, his health insurance coverage is so terrible. He would definitely fall into the underinsured category, and like all the stuff they need isn't covered. And so my mom's holding off on some important procedures and stuff she needs done because their insurance doesn't cover it, so they're switching at the beginning of the year to something new. What thoughts do you have regarding the health insurance policy? So consider the questions above when formulating your comments. Do not limit your comments to answering the question. So you can add something else. If one of the questions doesn't really pertain to you, that's fine. Just try to at least give some detail and effort into this assignment, but you don't have to answer all of these. These are just things to think about when formulating your thoughts for your post. Post a minimum of 1 comment to another student, and feel free to like as well. So that's going to be what's due Sunday. I think it's November 5th. Yep, Sunday, November 5th, as well as the assignment I just covered there. Okay, so then let me go back. Okay, so then module 12, most of the reading and stuff like that is in module 11, and then module 12 is going to be super short. And I just have an example of a podcast talking about the Affordable Cares Act, unfinished business. Let me see how long this is. Yeah, it's only 14 minutes, so not very long at all. You can have it on your phone, listen to it in a car ride, whatever you want for that. And then as you read, listen and consider the following question: who receives government provided health insurance? How much of the population receives this insurance? And are these forms of insurance efficient? And you don't have to answer these questions or submit it. Those are just some things to think about while you listen to it. Okay. Again, this is just another link to a podcast. And this one, it was 14 minutes as well. Okay. So then I don't think we will have a live session. So this is from Dr. Kathy Brown. She's a policy guru, and I'll have this available for you to listen to since we won't have the policy in-person lesson on Monday. So this is just a recording you can listen to, talking about understanding health insurance and government health insurance programs like Medicaid, CHIP, and Medicare. So I'll have that making sense for you in a video ready to watch. We'll have our module 12 quiz. And that's it. That's all we'll have. So I'll make both of those open. I don't know if this will be helpful. Maybe I'll just have all the due dates for that stuff. If we're in no hurry, I can just have the due dates to November 12th for you all for that. Yeah, I can do that. I'll just have everything for these next 2 modules due November 12th. So hopefully that'll be helpful for you. I think I say I have module 11 and 12 quiz due. So let's see. I think it's just 1 quiz covering both the modules. Yeah, so you'll only have 1 quiz due. So I'll update the syllabus and everything, get those dates on there for that. So and then let me see, then we meet November 13th, I believe. Let me pull that up. I have that here. We do meet November 13th, and that'll be a fun class. We'll talk a little bit about relationships and in the workforce and policy and things like that. So that should be pretty fun there. Let's see. I hope that answered a lot of your questions. Let's see, I don't think I have anything else. Thank you for watching this. I will have everything published this weekend, and thank you for your understanding. And I will see you November 13th, ordering office hours. Take care, everyone.